Well, good evening. Welcome to tonight's healthy lifestyle talk called Dark to Light, Coping with Stress, Anxiety, and Depression. My name is Joy Ingblade. I'm the Chief Medical Officer here at Northern Inyo. And we're really excited to be presenting these monthly healthy lifestyle talks. This is really a chance for us to provide some education to our community. It's a chance to showcase our wonderful workforce here at Northern Inyo, and also a time to tell our community about the services that we provide. So again, thank you for joining tonight. Tonight I'm joined by 4 experts. I am just the moderator, so I have no special knowledge in this area, but I've got 4 experts who are here to just help us kind of navigate through this tough time of year. It's the holidays, it's dark out, it's cold, and so having some tools that we can talk about that kind of help us get through this tough time. So I'd like to start with Heather Edwald. She is our inpatient social worker here at Northern Inyo Hospital. She's a licensed clinical social worker. She helps all of our admitted patients and their families really try to help navigate the mental health system. Linda Christensen is our outpatient social worker. Like Heather, Linda is a licensed clinical social worker. She's a certified clinical trauma professional who also provides psychotherapy and counseling services to our outpatients, including our medication-assisted treatment patients. Next is Monica Jones. She is one of our occupational therapists, and she focuses on pediatric occupational therapy. She is also a certified perinatal mental health professional. And last but not least is Dr. Auckland. He is a friend of Northern Inyo's. He's previously lived in the Eastern Sierra, and he comes back to visit often, which we always appreciate. He is double boarded in family practice and psychiatry, and he's been a partner to ours and Toyabe's in bringing psychiatric services to our area. So thank you all for being here. I just want to start, we're just going to do a pretty casual roundtable conversation. We're going to pretend like we're in the living room and just having a talk. Dr. Auckland, I'd like to start with you. If you could just start off by helping us define anxiety and depression.
Okay, thanks, Joy. So I start with anxiety. So anxiety is normal. Anxiety is worry and fear, and it's a normal part of everyday life. It's actually a healthy part of everyday life. So we have to remember that about anxiety. Anxiety is normal. Worry, anxiety, fear, all normal human things. But when it becomes a disorder, a problem, which is I think how we're using it here, is when it becomes really intense, excessive, persistent, and when the person starts feeling worry and fear about everyday situations. Sometimes anxiety can come in sudden, kind of overwhelming waves, which we call panic attacks. And anxiety, when it's a disorder, causes problems. That's the key thing, right? It's not a problem unless it causes a problem. And that's when a person feels really overwhelmed. They're unable to do things that they normally do without high levels of anxiety, or they're unable to do them at all. And it affects their relationships, their work, their ability to be the parents they want to be, or other things that they do. So that's kind of how I summarize anxiety. Depression, kind of most people know this word is meaning something like feeling sad or low or down. This also is a normal part of life sometimes. Maybe not a part of everyday life like the way anxiety is, but feeling lost, thinking negative thoughts, even feeling hopeless at times is really a normal part of human experience. But depression becomes like a disorder, a problem, when these feelings don't go away, or they go away for a little while, but they just keep coming back. And they can be there for no reason or for reasons, but it's still depression. Oftentimes there's this myth that if a depression is situational, in other words, if I can explain why I'm feeling so bad all the time, that it's not really depression. But that can really allow us to miss this thing that really is very common and very, very treatable. And the symptoms of depression are not just emotional, feeling down, but they're also physical. People who are depressed oftentimes feel really, really tired or really agitated and restless. They can have headaches and stomach aches or other physical pain. They're mental symptoms that people, they don't think clearly. They have trouble attending to things. Their memory is bad. Sometimes people think they're losing their memory. And then their behaviors change as well. They might, they don't do things they normally enjoy. They can't do things they normally enjoy. I should have mentioned about the mental too. A big part of it is actually misperceiving things, seeing things in a negative way, in a distorted way that's not accurate with reality. So,
And
That's-
so
that's
it
depression.
seems like adults would be a lot better at articulating some of these things, like saying I feel sad or saying that I feel anxious, and really kind of identifying some of those behaviors. But Monica, I want to go to you next because I know you work with kids a lot. So when kids are affected by these things, how do you look at them differently, or how do they communicate differently that might be a little different than what we would see in adults?
Yeah, so with kids, I use more kid-friendly language. I'll usually use zones of regulation, which is like a curriculum that aligns your emotion with a certain color. So, green zone, we're paying attention, we're happy. Blue zone, we're kind of tired, or maybe we're sad. Yellow zone, we're starting to get agitated, maybe we're worried. And then red zone, we've gone too far, we're losing it. So we try and use tools at the yellow zone. So I teach them to kind of recognize triggers, and then we'll do different interventions. So like with adults, I might do like a worry time self-regulation strategy, but with kids, I'll do like a worry jar. So they have to write down their worries and put it in the jar, and then they can't think about it again what sits in the jar. So different things like that. We play a lot of games, where they'll have to identify their emotions. Like we'll do like emotions Jenga, or kind of working on frustration tolerance, that kind of thing.
Okay. And then Linda, I want to go to you next because you work with most of our outpatients. So what are some of the tools you talk about with outpatients or patients who come to you with a lot of anxiety and depression about how to manage some of these things at home on their own?
Gosh, well, I like to think of our emotions as just parts of ourselves. And I know that sometimes when you're feeling overly anxious or depressed, it feels like that's all of you. Like I am nothing but depressed, or I am nothing but anxious. And so one of the best tools I like to use is to help patients get a little distance between that feeling, that emotion, that sense of being too anxious or too depressed, and realize that they can separate a little bit from that and observe it and change their relationship with it. So I use a lot of internal family systems therapy, sensory motor therapy, connecting the mind and the body in therapy, and also EMDR. So kind of eclectic there.
And EMDR is?
Eye movement desensitization and reprocessing.
And tell us about that.
Oh gosh. Okay, somebody wave me down if I start talking too long here, because it's so fun to talk about theories. But the theory of EMDR is that your brain is so immensely powerful. And if we can learn to channel the energy of it, we can help process some memories, some experiences that were kind of overwhelming to you at one point in your life. Maybe you had something happen to you that was really hard in childhood. Maybe you were an adult and you experienced something really overwhelming and you weren't really sure how to process it. And so it kind of gets stuck in your head, and it's looking for a place to be processed, like a little file cabinet in your mind. Where can it go so we can process it and be done with it and not feel all of that emotion that goes with it? And so EMDR is a technique that uses your brain's ability to do two things at once: to attend to something that you're doing, for example, eye movement or tapping or sound or something like that, something your brain has to pay attention to, while thinking about that episode in your life that was so overwhelming for you. And the theory is, if you approach your memories like that with your brain doing two things at once, it keeps your brain from being so overwhelmed that it can figure out how to put a file together, put that memory in it, and then file it away so it doesn't have to be so present in your day-to-day life, if that makes sense. So.
Interesting, very interesting. Heather, I want to move to you because as we kind of talk about, these events that happen, you are often seeing patients who are acutely ill. Nobody plans really to go to the hospital and be sick. And so how do you approach patients, or what are your suggestions for dealing with like that acute event or an acute illness?
I would say people may have heard the term mental health first aid. And so a lot of sort of my crisis work in the hospital has to do with crisis containment, which has to do with calming people down and making sure that they have the resources that they need. And it's a lot of very tangible, very immediate, like, okay, it's not just a friend that says, oh, call me anytime, what can I do to help? It's somebody that brings you a casserole, and that's sort of my role at the hospital, is to make sure that people have exactly what they need in the moment to sort of get through that initial crisis. And I also want to say that my services, it's not only just for patients, it's also a lot of family members. So yes, nobody really expects to come to the hospital and be super, super sick. But I'm also seeing family members whose loved ones have maybe passed in the ER, or families who are going through some extenuating circumstances, like with moms or babies in labor and delivery. There's a lot of reasons that people end up here where they're watching another person that they love very much go through something that they're really powerless to do much about. And so then that's where that emotional first aid comes in, just kind of helping them contain the crisis and get back out there in the real world in a way where, they can kind of keep their head above water.
And Dr. Auckland, with all these situations, I mean, you have these traumatic things that happen and you're having all these emotions, this anxiety and depression. I mean, at what point, or is there something, a red flag that would say, gosh, I need to go seek professional help? Like, I probably can't do this on my own. Is there anything along those lines?
Absolutely. Yeah. I think one thing, I guess the line I think of in terms of seeking help is when somebody starts feeling hopeless. And by hopeless, I don't mean like, what we all worry about is somebody's going to take their own life. I mean, when someone feels like there is no hope, it kind of cuts down their ability to keep trying things, which is kind of one of the essence of being a functional human being, is we try. But when we're feeling hopeless and we stop trying, it's going to be really hard for that person to move through whatever difficulty they're going through. So I think hopelessness is a real flag. I think inability to experience joy is a marker of severity of depression, when it's like the person can't brighten up. If it's a child, when they have their sibling is playing with them or something, or if it's an adult, when something good happens, if they can't brighten up or experience any pleasure, that's kind of a sign that things are pretty severe. And also if someone's not able to experience any times without anxiety. So if they're just living with anxiety all the time, there's no way to get calm, even when things are calm, that's a sign. I think a more kind of objective measure of when someone should ask for help is when it's actually impairing their ability to function, when it's causing problems. So people oftentimes think when it's affecting your work, or affecting a child's performance in school or college, or other things that you need to do, obligations you need to carry out with your relationships or family and friends. And people often forget that one, especially the family, because we can kind of be ourselves with our family. And I think everybody can notice when our work is slipping, or when our school performance is slipping, we're not making it to work, we're not making enough time, we're not focusing. But it's kind of like our spouse or our parents sometimes, or our kids for sure. We kind of can get pretty low in our functioning. People can be pretty darn depressed or pretty anxious, and the family is just it has to put up with it. And so people oftentimes miss that, how much, and then I think people miss even more how much when they're starting to lose their ability to function in friendships. because they kind of let go, and then friends might try to call a couple times, and they don't want to bother us, and somebody's getting depressed and anxious and withdrawn, and we lose sight of that. So I'd like people to kind of really keep that in mind. If you're out there and you're starting to have more problems with anxiety, depression, look around and see how it's affecting your ability to be a friend, a parent, a sibling, a child, all those things.
And Monica, if you could comment on, you're kind of coming at this from a different lens, you're coming at this from the occupational therapy lens. And when Dr. Ackland kind of talks about function, you're not able to function. Can you kind of talk about how you approach that?
Yeah, so I'll see people with mental health conditions that are affecting their ability to participate in meaningful activities, meaningful occupations. So maybe they're not sleeping well. Maybe the child is not playing. Maybe we're a teenager and we're not socializing. We're not exercising. So whatever it is that we do that takes up our day, that's an occupation. And if those areas are being affected because of a mental health condition, then I can help them make some moves towards improving that. So it's a very action-based approach. Occupational therapy is really like the doing therapy. So we do a lot of, okay, this is what's going on. What are we going to do to make this change to get to this goal that you want?
And then kind of along those same lines, Linda, if somebody has some of these red flags that Dr. Ackland has talked about and they want to come and see you, like, what does that look like? How does that work? All of that kind of stuff.
Well, it's pretty simple. If you want to talk to me, you just ask your primary care provider to put a referral in, and then we just sit down and we talk, and we try to get the lay of the land, like what's going on, like what Dr. Ackland was talking about. How are you functioning in your life? What would show you that you're making progress, that things are getting better? We talk about that in terms of making goals. And it's really just kind of a conversation about what's going on and what direction would you like to go,
And for both you, Linda, and Monica, and Dr. Ackland, how often do you normally see patients, and how many times a week, and for what duration do you normally follow patients? Linda, why don't you go first?
Okay, sure. Well, I see people with a variety of needs and a variety of intensities. And so some people I might see for maybe 3 months, and other people I might see for a much longer time. And it's so individualized, and really the patient is in charge of how long they feel like they need some help, right? So it's not like we can put an end date and say, well, it's all going to end in February, right? Because as you grow and change, sometimes new things come up that you want to work on. And so it's really just an individualized process for what I do.
Monica, what about you?
Yeah, so I usually see people for about 12 sessions, sometimes less, sometimes more. But really, it's once we are meeting all of our goals and demonstrate that we can maintain progress over, tapered sessions, then it's time for discharge. And, of course, if things change in the future, they could always come back. But yeah, it is usually, somewhere around that time period.
Dr. Ackland, what about you?
I think for me and for most psychiatrists, it also can vary. Like Linda was saying, it's, sometimes it can just be a one-time consultation. Most of the time what I'm looking at is to see if there are medical or other biological factors contributing that need to be taken care of, and also if there are medications that can help. And so if someone is really, really ill and they need to be started on a medication, I might see them pretty frequently in the beginning. It might even be as soon as, I'd see them first and see them again in a week and maybe again in 3 weeks. And I might see them, a couple times a month, even for the first few months. But once people are feeling better, usually once a month and once every 3 months. And ideally, we get to a place where people are feeling really well, and either we taper them off the medication that they needed for a while, or they're so stable and the medicine is something that they're going to need and they're going to want to take for a long time. I see them once every 6 months or once a year. Another thing that can sometimes happen is people can see me and we can figure something out that works, and then they feel very comfortable and confident in it. And I feel the same way, and they can just go back to see their primary care provider. And the primary care providers are really great and very knowledgeable in terms of taking care of mental health issues too. And I can kind of just offer my specialty help in the beginning and then go from there. So I always tell people that just because you're seeing a psychiatrist now doesn't mean you're going to have to see a psychiatrist forever. But if you need to see a psychiatrist for a long time or forever, we can do that too.
Okay, and then Heather or anyone else who wants to answer, I mean, this is the holiday season, and sometimes the holidays are triggers for people and it can be really hard. Do you have advice or tools that you would recommend for parents who have kids that are struggling, or if you are struggling, or if you're an adult and your parent is struggling, do you have any advice?
I think if I'm going to answer that one, I'll piggyback off of something that Dr. Auckland said. You know, a lot, and this has to do with the stigma that goes along with mental health. There's a lot of it, and I think in my career, I'm so aware of people coming in and they've got something going on that they really don't want to take a treatment for. They just don't want to try it because of, whatever their rationale is. And I try to put it like, okay, if it was any other medical diagnosis, if you had type 1 diabetes, would you take your insulin? Oh, most people say yes to that. If you had a broken arm, if you broke it on the ski slopes, would you have it casted? Oh yeah, I would definitely do that. But especially in context of the holidays, you might have this one period of time during the year that you need a little extra boost. And people are like, oh, no, I don't need meds. I won't try that. And it's kind of like, why not? So there is a lot of stigma there. And I guess I would just encourage people to look at it like anything else. You don't need this forever, potentially, but it's one more tool in the toolbox that if people have enough tools in their tool belt, they're more likely to find something that works, given whatever circumstances they find themselves in, holidays included.
Do any of you have, we're talking about a lot of tools. This day and age, we all use apps. Are there favorite apps? Are there other resources that you often direct patients to kind of help with some of this?
There are a lot of apps, but I think before we go there, if it's okay, Joy, I have a thought that I wanted to offer about this holiday thing.
Yeah.
And I'm seeing in terms of the people who are listening in, there are a few healthcare providers out there from the primary care clinic too. And I think this is just for all of us to think about. The holidays, one of the reasons the holidays are hard is because many people feel like their families aren't the way they want them to be. It may be that a lot of times it's lost. A lot of times it's just not that our families are not everything we want them to be. They don't work the way they should. People don't get along. People are really bad to each other. Really bad things have happened between people. People don't talk. Some people don't come. Maybe I don't come, And I think there's a big myth that everybody else's family is good and healthy and happy and normal, and I'm defective somehow. And I think if you really ask around, there are some people who are fortunate to have really lovely families, but there's so many of us out there who don't have that. And so I just want to offer that to everybody and ask you all to share it as well, because I think I see that as such a big driver of increased problems over the holidays. And there are many people who are just sharing the holidays with a friend, or maybe a friend of a friend, maybe people you don't even feel that comfortable with, but you're with somebody. And it's really hard to be alone over the holidays, but also, even if that's the case, to know that you are not the only one, that many people are alone, and many people have been alone, and in some bigger way, just to remember you maybe won't always be alone. And even if you are alone, it's okay, because this day will pass. You were going
If
to
I
say
could
something.
add to that, Dr. Ackland, I would note too that social media does not help with what you're describing.
Yeah.
Because people get on social media and they tend to only share the good things.
Mhm.
And so I think as social media has really taken off, we watch everybody else and we think, oh my gosh, my family isn't behaving, but everybody else's is because that's what they're posting. It's not
Yeah.
really the case. It's
Right.
misleading.
It's so true. It's this tragedy, right? That this joyous time also brings so much pain because we compare ourselves and we find ourselves feeling, deficient from what we feel like we should be.
And I would add too for, just getting outside and exercising or even just relaxing outside, making each other, playing games, like being silly, making each other laugh, like laughing makes us feel so much better. So, exercise is one of the easiest ways to feel better. There's a lot of research out there supporting that. And if you can't exercise, even just being outside for a little bit helps with your sleep, helps with your mood, so just finding things that are fun to do and kind of getting out of your comfort zone, reaching out to people as much as possible, socializing more, even though sometimes it's uncomfortable to do. Remember, you're going to feel better afterwards. So it's good to do.
I want to underscore what you just said there, Monica, because this exercise thing it's not just kind of like good advice or grandma's advice or doctor's advice. It's actually the research shows that physical exercise, physical activity, and especially outdoor activity is not as effective, but more effective than any antidepressant that your primary care provider or I can prescribe. And if we could just help people do that, which is a lot of what we try to do, we could do a lot for depression and anxiety. I have another thing that I'm going to kind of go out on a limb about. Has anybody ever heard of laughter therapy? I know Linda is going to talk about a really cool hack for depression and anxiety problems, but this is kind of an interesting hack. So there's a therapy called laughter therapy that's based in this observation that just laughing can really change our moods and change our brains. And it was this doctor out of India that started noticing that if you could prompt people to laugh, it would actually elicit this response. And now there are laughter therapy groups all over the world that you can sign up for. And so if you are feeling a little bit low, the way these groups work is you actually just start laughing. One person starts laughing in a forced way. And then pretty soon what happens is everybody else starts laughing. So we might even just demonstrate that right here.
Everyone needs to unmute themselves.
Oh, you have to
I'll hear the
unmute because
laughter.
thank you for pointing that out, mediator. Facilitator. Here we go, moderator. All right. So, does anybody want to report on how that went for them?
That was pretty fun. That made me feel better.
Yes.
Yeah,
Helped me relax a little bit.
for sure. So it's definitely something you can practice next time you're having people over or whatever, or if you're at a meeting, a tense meeting, you can do that too. The funny thing is when we start laughing, and it's bizarre, we start laughing naturally, which it crept in pretty quickly for me. It really does something well for us. So anyway, that's my little hack for depression.
And Linda, do you have another hack?
Oh, sure. If we have time, I can give you a hack. And the nice thing about this is you don't have to be depressed and you don't have to be stressed out. You can just be whatever mood you're in to start using this hack. And I want you to start out imagining that you see a beautiful green turtle and it's swimming in this blue ocean. And it's swimming in very deep water. You cannot see the bottom of the ocean. And when the turtle looks out, it cannot see any land around it, and it's just swimming. And the water is up to its chin, and its whole body is under the surface of the water, and its little legs are just moving. And get that picture in your mind. And I want you to think to yourself, do I have anything in common with this turtle? How am I like this turtle? Maybe life's been throwing you a lot of hard stuff lately. And it just keeps coming and coming. And you're starting to feel like you're going under, like you might be drowning, like your mood is just pulling you down under the water. Or maybe you're really busy. You've got kids and work and parents and pets, and you're just busy all the time, fixing things, worrying, swimming faster and faster and faster just to get it all done. But when you look around, you don't see any resting spot for you. Where are you going to rest? Or maybe you're not feeling depressed. You're not feeling stressed out. Maybe you think, gosh, I wish I could just ride the waves of life a little better. Just kind of learn to go with the flow. Well, this hack is for you if you're in any of those categories. And the great thing about this hack is it only takes about a minute a day. And it all centers around gratitude. Gratitude, they've studied this. They have found that gratitude helps improve your mood, improve your relationships, improve the level of cellular inflammation that makes your body feel like it's out of whack and causing illnesses. The list is so long. I'm sure Dr. Auckland can do a much better job of explaining the medical side of it. But the fact is, gratitude is a simple thing that you can add to your day to change the way our brains work. The thing about our brains is they're so amazing, and they are naturally wired to look for danger, to look for threat, to look for anything that might harm us. We don't even have to think about it. Your brain naturally does that. And that makes sense because your brain's number one priority is survival, right? So of course you're going to look for danger. The problem is that makes us tend to look at the negative in life really easily. And it takes intention, it takes effort to train ourselves to look toward the positive. But when we do that, every time we look toward the positive, we're strengthening that neural road in our brain that helps us get to the positive faster. So here's the idea. What I want you to do is every day for the next 21 days, I want you to try this gratitude challenge. Now, side note, usually it takes about 30 days to build a good habit into your life. It's the holiday season though, so I'm cutting you a break. I'm going to cut it back to 21 days, okay? 21 days. If you start today, you can have 21 days finished before the big Christmas day and all the other holidays that come along. It might be worth it. What if it helped your relationships, your mood, the way you went through your days? Because you know that famous quote that I think Annie Dillard? Anyway, famous quote is, the way we spend our lives is, of course, the way we spend our days. And so let's just make little changes to our days and see how our lives are affected, okay? Here we are, 3 steps. First step, I want you to, every day, write down 3 things you're grateful for. Now, I can almost hear people's thoughts right now. Some of you are saying, oh, brother, I already do this. I already go to bed, and before I go to sleep, I think of all the good things that happened in the day. Great, because if you already do that, you are halfway there. But what I want you to do is write them down. Write them down. And I'm not talking about going out and buying a fancy leather journal or, making some sort of memoir out of every good thing that happens to you. No. Just a list. All we're making is a list. You can write it on a sheet of paper, the back of an envelope. Go to the dollar store and buy one of those dollar notebooks, right? Just anything that you can make a list on and write down 3 things you're grateful for. Now, second rule is reflect on, why did those good things happen today? Was it because you made a huge effort to make progress toward a goal? Was it because you studied hard, worked hard, planned, executed your plan? Was it because you were in the right place at the right time? Was it because of someone else's kindness to you? Reflect on why it happened. Any reason it happened is a good reason. No reason is better than the others, but reflect on, why is this goodness in my life right now? And the third thing is, when you're making your list, try not to repeat anything you put on your list. This is why it's important to write it down, because you can go back and check. Oh, did I mention that I'm grateful for my hot coffee today? Oh, I already did. Can't put it on the list again. And the other thing about writing it down and checking back is, if you're having a hard day, it is so nice to look back and see what good has been in your life that day, that week, or that month. So just to review, write down 3 things you're grateful for, reflect on why they happened, and try not to repeat.
Well, those are great suggestions. Sorry,
Yes.
did I cut you off? Were you going to say something else?
I was going to say, if you're an overachiever out there, you can add a savoring practice to this. And that is to just, every time you notice something good in your day, take 10 seconds to drink it in and feel all the good stuff that comes with it. And that is going to boost it up. That's your superpower if you're an overachiever. So anyway, I hope you'll try that hack, and email me if you want. Let me know if you're trying it, how it's going. I'd be so interested to know. So
I love that. All right. Well, I think we're going to kind of wrap up this conversation. I think we've kind of talked about what anxiety is, what depression is, when to seek help. You've now met 3-4 people who are in our community who can help. We've heard about some tools to use. We've heard about laughter hack, gratitude hack, and I think this is all really great information. So now I'd like to open it up to our listeners, whether you're on Zoom or on YouTube. You can unmute yourself and just ask a question to any of our panelists. You can type it in the chat. I think Barb is kind of watching that. But please, what questions do you have for this expert panel tonight? So Alicia, I heard something from you. Do you have a question for one of our panelists?
No, not really. I was really interesting, to see this, because I was kind of last year I had the anxiety so bad, and then I was trying to get some pills and everything, and I think that it really works for me, try to figure it out in my mind. It is I have to change my mind, not to worry about, not to think about bad things. And then it's really interesting, like everything you guys said. And then I'm going to follow the, like the 3 steps she said. So I'm going to start it tomorrow. So
That's awesome.
yeah. So thank you. It's not really a question. It's just,
A really good comment. So we appreciate that.
Thank you.
The gratitude practice, I just want to also echo what Linda was saying. Really, really a powerful tool. And again, not something that just makes sense. There's really data to support how it does change our moods and change our brains. And you don't have to be depressed. So it's actually harder to do if you're depressed, probably more important to do if you're depressed, but it's actually it's just a really effective tool.
We do have one question that's kind of specific to the workplace. What are some key ways or tools that we can use to improve depression in the workplace? I don't know who wants to take that one.
I can recommend some things to help. Something I do is I try and compliment my coworkers, which helps you feel better. It helps them feel better. And I ask for help from people that maybe look like they're maybe having a hard time, so again, it kind of boosts their confidence and it helps you feel better because you've done something for somebody else. So I think that's that's one of the easiest ways to kind of improve your mood, is by kind of bonding more with those coworkers. Even if it's a difficult coworker, that's even more important to find ways to, oh my gosh, you're so good at making that coffee, like you make the best coffee, or can you help me organize these in Cerner, or whatever it is, so I think just working to improve everybody's mood in the workplace can be really helpful.
I'd kind of like to ask the person who's asking, just to clarify a little bit, does this mean depression that's happening just in the workplace, or does this mean somebody who's depressed, and what can we do in the workplace to help depression?
And maybe while we're waiting for the answer, do you want to kind of answer that first question,
Yeah. Well, I guess I kind of think about the more severe case when if somebody is depressed and that they're in the workplace. So there's a couple things that can happen there. One is actually to talk to people, including your supervisor, if you feel like you have a safe and supportive workplace, or talk to your coworkers. Now, this can be scary because if your livelihood is on the line, but talking to people about going through a hard time can be really, really helpful. If there are people at work you can talk to. And then there are other times when depression is so bad that actually work, and sometimes some of us aren't fortunate enough to have a good workplace environment. And sometimes a medical leave from work is actually what needs to happen so you can get more intensive treatment. So I just want to put that out there if that's the question. But there are a lot of, I think asking for help in the workplace from fellow human beings is definitely probably the number one thing I would do in the workplace to help me feel less alone and less depressed.
And then there's another question, as a provider, I often have difficulty getting my patients in for counseling. Often what I've done is to encourage them to schedule a follow-up with me on a weekly or bi-weekly basis, just to check in and let them know that they're supported. But this is not a specific kind of mental health provider, but wondering if this is potentially detrimental, kind of one of those no good deed goes unpunished. You're really trying to help support your patient. What are your thoughts as you for being mental health providers?
I have an answer for that one, I think. When I read that question, I think of some of my experiences that I've had over on the OB unit. And what I have found is that our nurses particularly, but sometimes just our, other providers in the system, really underestimate the ability that they have to help the patients, because they are on the front lines often with the patients, and they are the ones that the patients have the relationships with. So it's all lovely to call the hospital social worker and say, we need a social worker. But I also think that there's something very, very special about the relationships that people with all these letters at the end of their names, you don't have to have a mental health certification or license or whatever to be helpful to people's mental health. So I think to that question, I would say probably it's not detrimental. And if you get a patient that leans on you a little bit too heavily, you will find that you are starting to feel resentful, or you're starting to feel a little bit crushed by that weight. And it doesn't mean that the patient's bad, or that what you did is bad. It just means it might be time to pull back a little bit from that and start changing the boundaries up a little bit so that it doesn't get detrimental. Is that fair?
I love that answer, Heather. And yeah, I think, and you really nailed it. I think a lot of primary care providers worry about that they're not getting the person the best care and that they do underestimate. They either underestimate their own potential, or maybe they overestimate ours. But it really, the most powerful thing we have in mental health is actually to be a kind listening person. And even when you do studies of different modalities of psychotherapy, the one thing that is shown to be the key predictor of whether a psychotherapy works is not which kind of psychotherapy the expert therapist has been trained in. It's the rapport that is developed between the mental health clinician and the patient. And so primary care providers oftentimes have excellent rapport with their patients, and they have them because they've known them either when they saw them just for one visit in crisis and they're just seeing them after that, or they've known them for years. No, I can't see it being detrimental. And even if you are worried about that patient who maybe you're worrying that they're becoming dependent or not using other things, you're not going to harm them in any lasting or significant way. I think you're never going to do wrong. I love the primary care provider's question, and that they do that for their patients. That's great. And I'm really glad that primary care providers still have time in their busy schedules to do that as well. Yeah, good work.
Well, Barb, are you able to put up the information, all the contact information for our speakers? I think that this would be something that we can post somewhere else, or at least put up ways to connect and ask questions. If you have further questions, if you're concerned about yourself or somebody else, please reach out to any one of these people, including myself, Barb. We can definitely point you in the right direction if there's any concerns. Panelists, any final thoughts, words of wisdom, things to leave us with tonight? You've already imparted a lot of wisdom, so I know I'm asking for a little bit more.
I think the thing I try to share with all my patients, and I think something that all humans should really know, is that everything changes. Nothing is permanent. If you're feeling badly right now, you will not always feel this way. Even if your brain is telling you you will always feel this way, you will not. And whether you get professional help from somebody like the people here, or whether you get help from a friend or family member, or whether you get help just from prayer or faith, or whether you get help just from time, this will pass.
Well, I think that's a great place to end. Thank you, everyone, for coming. Thank you to our panelists. Thank you, Barb, for making this all happen from a technological standpoint. Again, please don't hesitate to reach out to any one of us. We can get you the help you need. So thank you, everyone.
Thank you. Thank you.
Thank you.
Thank you.